Hi, Kevin Sartin with Non-Master Physical Therapy with an educational video on hip bursitis. So hip bursitis is whenever a bursa in our hip, which is a fluid-filled sac that our tendons glide back and forth on, becomes inflamed and irritated. There's a couple different locations where this typically occurs in the hip. One is the trochanteric bursitis. That's when you have pain on the outside of your hip. There's iliopsoas bursitis on the front side, and then ischio-gluteal bursitis in your buttock area. So they have kind of different presentations. So the trochanteric bursitis are the one that is most common. You get pain on the outside, and these people will typically have pain with activities like walking, going up and down stairs, especially laying on their side at night. Iliopsoas bursitis. Typically, these people will have aggravation with hip flexion activity. So that can be walking, that can be running, cycling. They can have pain with resisted hip flexion. So if they're pushing against something, that will recreate that pain. And then ischio-gluteal bursitis will be aggravated with sitting because you're sitting right on that bursa. Another thing to kind of rule that out versus piriformis syndrome is this pain will typically just stay in this area and you won't get symptoms that radiate down your leg. The people that are most likely to have bursitis are women. Sorry, ladies. You're 3 times more likely to have bursitis than men are. It's more likely if you have other conditions such as hip dysplasia, if you have a leg length discrepancy, if you're overweight, if you do repetitive activities such as long distance running or cycling. Any of those things that are adding stress to that area over a long period of time can increase the likelihood that you would develop bursitis. As far as treatment goes, it depends on how you develop that bursitis. So if you're someone that is very active, maybe you do long distance running and you develop the bursitis as a result of that, guess what you're going to do? You're going to take it easy. You're going to stop that aggravating activity for a little while. You're going to put some ice on it, let things calm down. You can do, physical therapy if the rest alone doesn't help relieve your symptoms, and physical therapy is going to help to desensitize that area further and strengthen the surrounding musculature to help you get back to what you're doing. And then, you can also take pain medications such as NSAIDs, and injections can also be considered if physical therapy is not beneficial. So that can be corticosteroid injections, hyaluronic injections, and PRP injections. All those can be considered. And when I go back to how you develop this, if you're someone that is more sedentary, and overweight, then your treatment is not going to be rest. We have to get you active. So it's definitely going to be exercise, whether that's in PT or on your own. You want to try to strengthen those muscles around that area and try to reduce whatever activity did aggravate it. So maybe it's the ischio-gluteal bursitis. Maybe you're sitting for long periods of time, so we want to get you up and standing more, so we're taking the pressure off that area and allowing it to heal on its own. So hopefully that was helpful. And give us a call. Whoa, it was bad at the end. Everything was good, so we're going to keep it. We're going to keep this video. If you need any help or further questions, give us a call or visit us at our website at notpt.com.